Non-melanoma skin cancer is by far the most common type of cancer that affects people here in the United States, with about 2 million patients being diagnosed each year.
Non-melanoma skin cancer is generally broken down into two categories, basal cell cancer and squamous cell cancer. Both of them tend to arise in areas that have been previously sun damaged, though they can occasionally occur in other areas.
So we now have a new modality for treating skin cancer called electronic brachytherapy. This is a very unique form of radiation therapy that allows the dermatologist to treat patients in the office with minimal shielding. This is a non-isotope form of radiation that is delivered directly to the skin cancer site.
Having the ability to use electronic brachytherapy, I'm now able to treat some of the cases I might otherwise have referred out.
The ideal candidate for Xoft treatment, rather than possibly treating with Mohs surgery, are patients who have tumors in cosmetically challenging areas or candidates who are on blood thinners.
Carol and I went in for our 6-month checkup with Dr. Barron, our dermatologist, and I pointed out to a small area on my nose that I told him didn't want to seem to heal. It was small, but it wouldn't heal.
Treatment of a lesion inside of the orbit or the nose can be easily accomplished with the Xoft system because the instrument can be placed directly over the area and run very little, if any, risk to surrounding tissues or deeper tissues.
When I met with Dr. Barron to discuss the results of the lab, he explained two options to me. One of them was surgery, and the other one was electronic brachytherapy. I had seen others who had cosmetic surgery. I really didn't like the end result.
From a patient standpoint, the key benefits of the Xoft treatment is, number one, it is completely non-invasive and painless. Another huge advantage for our patients is the excellent cosmetic results that the Xoft treatment provides for these patients.
Treatments were a breeze. I couldn't believe how easy it was and how brief it was.
The nice thing about the Xoft treatment is it takes place in our office. Because it is such a low-dose form of radiation, it's safe for the therapist to be in the room at the time the treatment is occurring, and that's very comforting to a lot of our elder patients. It was very important to us that any new technology we incorporated into the practice have sound scientific evidence behind this. The thing about the Xoft brachytherapy device is there have been over 3,000 patients treated with the machine, and we have now 3-year data to support the efficacy and long-term results with this modality. Treatment with the Xoft modality is a collaboration between the dermatologist and the radiation oncologist. As a dermatologist, I know how to treat skin cancers very well, but I don't know very much about radiation.
For the past 3 years, I have been conducting a clinical study on my patients with non-melanoma skin cancer treated with the Xoft system, showing overall good cosmetic outcomes, low toxicity, and most importantly, no recurrence. At ASTRO 2013, I presented up follow-up data on these patients, now showing at 3 years there were also no recurrences and showing excellent cosmesis.
The Xoft system is an excellent combination of safe technology, reliability, no pain.
With typical electron beam radiation, patients are going to the hospital for anywhere between 20 and 30 treatments or fractions. With the Xoft treatment modality, we're able to treat a skin cancer successfully with only 8 sessions.
Because the Xoft system uses electronic brachytherapy, it wasn't necessary to make any special retrofitting or change to the office in order to implement this technology.
Electronic brachytherapy allows for rapid dose fall-off, meaning that there is minimal dose beyond the region of interest with minimal dose in the surrounding critical structures or critical tissues.
Having the Xoft system has allowed me to differentiate myself from other practitioners by having a more comprehensive number of choices and using the most up-to-date, state-of-the-art therapies available.
I couldn't be more pleased to have been treated with Xoft. I'm so grateful that we didn't have to do any reconstructive surgery and that the cancer is gone. And I couldn't be more pleased.